First and foremost, I'd like to thank you all for coming, taking the time out of your busy schedules to meet with me regarding this new and hopefully very exciting telehealth program that I've devised to address the need of the Native American population surrounding us here at Azusa Regional Medical Center. Um, Specifically, this population has a very high incidence of type 2 diabetes. My name is Kimberly Lynn, and I'm both nurse leader as well as spearhead of this program. As you are all well aware, a large percentage of our hospital resources are currently being consumed by members of the Native American populations surrounding San Bernardino County. This population, again, has a very high incidence of diabetes. Statistics show that nationwide, among the Native American populations, the incidence of type 2 diabetes is around 16.3%. Here at Azusa Regional Medical Center, most of our diabetes patients do come from this very isolated population, and they're anywhere between the ages of 18 and 79. But what is most concerning is that of the hospitalized patients for diabetes-related emergencies, 20% of them are under 40 years of age. So what that indicates to me is that there is a huge need for an intervention of some sort regarding lifestyle changes, glucose and medication management, as well as education for prevention, especially in the youth of this community. The biggest driving factor on our side is that this disease is, as we know, very responsive to prevention as well as good management, lifestyle change, diet changes, and therefore this is the main goal and drive of this business plan. The plan for implementation is the following. We plan on utilizing existing resources that are currently on the reservation to the most of our advantage, such as the already existing clinic there on the reservation that is open Monday to Friday, 8 a.m. to 5 p.m. It's currently staffed by one LPN, as well as one administrative person, who we also plan on collaborating with for the efforts of this program. We also plan on cooperating with and coordinating with the tribal leaders who will hopefully spread the word about our services to their community members. In addition to the already existing staff, we plan on hiring an additional 2 per diem nurse practitioners, as well as 3 half-time registered nurses who will be servicing community members from a distance here at the Azusa Regional Medical Center. We'll also be hiring 1 full-time medical assistant who will be there on site at the clinic to assist the LPN with any operating needs such as intake procedures, glucose reading, checking patients in any emergency scenarios, and other operating needs that they may have. For the patients, the clinic visits will be scheduled in 15-minute, 25-minute, or 35-minute increments. These are all going to be held virtually. The patient can meet a nurse or a nurse practitioner, whatever it is that their need may be. We'll also be holding group classes up to 5 people at a time, and our classes will be teaching patients about nutrition and lifestyle education. So after speaking to tribal leaders, we've determined that there are about 10,000 tribal population members, and given the 16.3 statistic that I mentioned earlier of diabetes prevalence nationwide, I might have mentioned it, not sure if I have, but about 16.3% of Native Americans in the U.S. suffer from diabetes. Therefore, given these numbers, there's a potential for about 1,700 patients to be included in our program. So what we anticipate is that the program will probably have a slow start. However, we hope to recruit about 30 patients in the first 3 months, and that is our goal. For the next 3 months, we want to see 50 patients. And by the end of the first year, we want about 100 patients per month for the remaining 6 months. Regarding revenue and expenses, we've taken into account 3 very important items, such as the capital purchases, anticipated revenue, as well as operating needs. So in terms of capital purchases or one-time purchases, we are hoping for more computers, a crash cart, an AED machine, and other safety measures to prepare for such a great influx of people that we plan on seeing. Um, Anticipated revenue are payments that we hope to receive from insurance companies, Medicare, Medicaid, private insurers, as well as patients themselves, those who have the means to pay out of pocket. In terms of operating expenses, these include salaries and benefits for our staff, any marketing efforts, and other maintenance needs of the telehealth program. We anticipate a net gain of about 40 grand in this first year. However, clearly that is not enough. The anticipated costs of salary and benefits for our team that we mentioned will far exceed this amount, and therefore other recruitment methods as well as grant writing, which will only be made possible through your support and your collaboration with us and your contributions to us. All these things will be vital to the success of this program. It's important to emphasize that we anticipate and are preparing for this very limited gain in the first year. However, we expect tremendous growth into year 2 and beyond, and for the cause, it is well worth it. What we do plan to achieve with this program is multifold. First and foremost, our main goal is to be able to direct patients down a path of increased quality of life without hospitalizations, without any emergency situations related to this very preventable disease, as well as we want them to prevent disease in their loved ones, especially the young ones in the community. Another one of our goals is to decrease 30-day hospital readmission rates, which have been projected to cost the hospital close to about $300,000 in this last year alone. This cost savings will provide the hospital with more money to be allotted towards more important things, research, education, other units, because this very preventable situation will be better handled. Not to mention, this saves us staff time, physician time, nurses time, and it'll open up a increased number of patient beds for other life-threatening, maybe not so preventable conditions. Scheduling visits with a very highly experienced nurse and or nurse practitioner, whatever it is that the patient may need, will be very easy for the patients to do. They can do so on their devices, iPads, computers, or a simple call to the clinic, and these are all for non-emergency related situations that are within the scope of practice of the nurse or the nurse practitioner to treat. This allows patients more flexibility in terms of their time and scheduling, and hopefully they'll be more committed to following through with these follow-up appointments with us, and therefore prevent these costly hospital admissions, which are costly for both the hospital as well as the patient. Clearly, both sides will benefit from this program. So here is one marketing brochure that the hired marketing company created. And our plan is to actually send this out to all of the residents in the 95555 zip code. Our plan is to target as many families as possible, and we feel that by mail this is the correct way to do so. So inside this brochure, it states our mission and goals to serve our community. It as well includes an instruction on steps to take on how to schedule an appointment with us. There's contact information as well as our clinic address, email, and any other relevant information to reach us. And if this brochure isn't applicable to the person who opens this mail, there's a quick blurb up here that says to hand it to someone who may benefit from it. In addition to these efforts, we've also spoken to tribal leaders who have agreed to allocate resources to promote our cause, such as advertising the program during any and all town meetings, and or asking representatives to do so. They're also letting us utilize their staff members who are there currently on the reservation clinic. And we also plan on advertising this program on utilizing the web, on Google, as well as Craigslist, hoping that the more technologically savvy youth and young adult population will come across our ad and share it with others, with loved ones and other family members or friends. Again, we're beyond excited to begin this program. We anticipate that it's going to start in July 2018, and we are asking for your support in mentorship and collaboration with us, as well as contribution to this program. Our contact information can be found here in this flyer, which I'll be passing out. I can be reached by email or phone at any time, and I look forward to meeting with you and working with you all. Thank you, and let me know if you have any questions.